So my story begins in 1997. I was 29 years old, and I started having symptoms of colon cancer. I had the traditional symptoms of feeling like I was had blockage, I was cramping, I had blood in the stool, um, but I wasn't lethargic and I wasn't really anemic. I kept a full schedule, so like many people who are in their younger years, I was misdiagnosed initially, but I did obviously follow up further, and I was diagnosed with colon cancer at age 29. Now, it was not an out and out shock. It was obviously surprising given the age, but I also had a family history of colon cancer, so I kind of had that going for me or going against me, if you will. Grandfather had colon cancer in his 60s, lived well into his 80s. My father had colon cancer in his 40s. He's now 82. So even though it was on the chart, it was still a surprise. Anyway, chemotherapy for 6 months. Obviously, surgery was a significant issue back then. You're cut open like a tuna. And but it kind of became a bad memory after a period, and you moved on. That's just kind of how we did things. It got a little more complicated when my older brother developed colon cancer when he turned 37, which was a couple of years after me, and then I had a second reoccurrence, or actually as a primary, at age 40 in 2007, which ultimately turned into the whole genetic component, which is, 2007. I joked that Al Gore hadn't invented the internet back in 1997, so 2007 people were talking about genetics. I was diagnosed with something called Lynch syndrome, which is the genetic form of one of the genetic forms of colon cancer, and other body parts were checked, and I found a kidney tumor. Sure enough, 2 years later in 2009. So this has become a way of life for me. It's constant maintenance. It's always keeping track. It's looking at multiple body parts. I call them my quarterly annuals, because the genetic form, the Lynch, can lead to bladder cancer, prostate cancer, breast cancer in men, obviously the kidney cancer, and in women who develop Lynch, it can be endometrial cancer. It can be significant. So this is part of my world, constant maintenance, and I make the best of it.
For an interactive tool to learn more about your colon cancer and your personalized treatment options, go to mycoloncancercoach.org.